some gauze.
Where? Use. Oh, good. Thank you. I'm clean off for not having my supplies. Okay. Anyway, that's
I
fine.
guess you just got my
What
mouth.
I'd like you to do is show your teeth. Okay, and I'm just looking at her teeth and her gums. Open up wide for me. I'm looking at her buccal mucosa. Can you lift your tongue up to the top there? Looking underneath her tongue. Okay, we put it back down. Looking at her hard and her soft palate. Okay. Oh God, are you gonna throw up on me? Okay. Open up your mouth. Kind of lean forward a little bit like that. That prevents some food. Okay, and I'm gonna look at her palate and say ah. Okay, and I'm looking at her. Okay, good. Her posterior pharyngeal wall, her tonsils. That's good. Okay, I'm gonna take the gauze. This is weird. Can you stick your tongue out? Okay, and I'm gonna just kind of palpate, kind of.
Oh my
It's not removable. And then I want you to push your tongue against my finger here and against my finger here. There you go. All right, so that's the mouth. Okay. Now I'm going to move down to the neck, and I'm going to just feel for lymphadenopathy. Okay. Any pain or tenderness when I feel here? No, there's no pain or tenderness here. Can you open and close your mouth? Okay. And then I feel for temporal arteries. I almost forgot those. That's normally not the same way to do it. Okay. And so at this point, what I'm going to do is do her lung assessment before I lie her back down posteriorly. Okay? So I'm going to move around. And I'm going to do palpations, feel for crepitus. Any tenderness?
No.
Okay. Say 99.
99.
99.
99.
99.
99. 99. 99. 99.
Good. I'm going to have you take a deep breath in, chest expansion, and out. Good. And then I'm going to auscultate. We're going to work through this real quickly. Of course, I would do it through clothing, right? Okay. Take a deep breath in and out through your mouth. Okay. And I go all the way through the auscultatory site, so you don't have to breathe, okay? You're going to listen, listen. Okay. I'm going to check for CVA tenderness. V pain or tenderness, I'm going to press here. Okay. And I'm going to go anterior to posterior, or anterior posterior to transverse diameter. Okay. And then now I'm on the front. Okay. Now I'm here. What I'm going to ask you, hello. I'm going to have you lie down. Okay. And I'm going to go, even though we just did the lungs, I'm going to go back up to the neck because I didn't catch the neck before. And so I'm going to look for JVD. She's a little high.
I'm 45 here.
But we'll just go with it. Okay, so we're looking for JVD distension. And looking at carotid, her little carotid pulse, that's pulsating. I'm just really getting your heart going in my, okay? And then I'm going to auscultate. Maybe turn towards me. Okay. And hold your breath. Okay, hold for me. And hold your breath. Okay. I forgot the thyroid. Okay. So we're going to go ahead and move down again. I'm going to feel for any pain or tenderness. Okay. Okay. And then I'm going to go ahead and listen to breath sounds. Okay. Deep breath in and out. In and out. Okay. And I'm going to listen, auscultate all of our areas. Okay. Now I'm going to listen to heart sounds like I did before. And you can just breathe normally. And then under And then I'm gonna diaphragm it, or bell it. Okay. And when I did the chest, I was feeling for not only crepitus, but I'm thinking about the respiratory status, but I was also feeling for lips, thrills, heaves. Okay. So I'm done, except that I need to go back to get her thyroid. I'm going to just store that away, remind myself, because I'm ready to move on down. So the next thing I'm going to do is look at her abdomen. Again, you remember you guys aren't going to have shirts on or you're going to have just sports bras on. So I'm going to take a look at her abdomen and do my inspection. I'm looking at the umbilicus and inspecting that as well. Okay, so my inspection's good. Now I'm going to auscultate. And again, not through clothing. Okay? So I'm going to do all 4 quadrants. And then I'm going to do light palpation.